Anemia, or what is also called low hemoglobin level. A shortage of sound red blood cells in the blood is the main cause of it. These balls carry oxygen to the body's tissues. The causes are many and varied, which we will talk about today in detail. Also covered are how to avoid it, as well as the causes and symptoms. At the end of the video, we will offer you natural and safe solutions to get rid of the problem. What's anemia mean? It's a decrease in one of the measures of red blood cells, which includes the following. 1. Decreased hematocrit. 2. Red blood cell count. 3. Decreased hemoglobin concentration. Now, what is hemoglobin? Hemoglobin is a protein rich in iron and red in color. It is present in the red blood cells of human blood. And it carries oxygen from the lungs to the rest of the body. Then it returns carbon dioxide to the lungs. Each component, which comprises 4 protein molecules, is referred to as a globulin. They carry iron particles inside. Additionally, oxygen and carbon dioxide are carried by hemoglobin to the lungs. To get it out of the body. It also produces most of the blood cells, including red blood cells, in the bone marrow. It must be known that the average cell life is between 110 and 120 days. What are low hemoglobin causes? Age, diabetes and cancer. Donate blood regularly. Impaired thyroid gland functions and secretions. Not eating foods that contain an adequate amount of iron. Infection with some diseases such as diseases of the gastrointestinal tract. Not taking vitamins and supplements, especially during pregnancy and lactation. To buy any anemia supplement, the link is in the description. Causes of anemia. Worms. Hemorrhoids. Aspirin therapy. Esophageal varices. Colon and stomach cancer. Gastric and duodenal ulcers. The presence of fibroids in the uterus. Anemia is more common in women than in men. Due to the amount of blood loss during menstruation and childbirth. Also, during pregnancy, a low red blood cell count may occur. It can also occur during labor and delivery. It can be treated by taking iron, folic acid, and vitamin B12 rich supplements. Anemia is a rare case among men due to the absence of natural causes for this condition. And men's lack of iron means something more serious, such as colon cancer. To avoid the symptoms of anemia, it is recommended to provide the body with iron daily. Severe anemia symptoms. 1. Pale or yellow skin. 2. Skin and hair dryness and weakness. 3. Shortness of breath. 4. Vertigo, dizziness, or headache. 5. Rapid and irregular heart palpitations. 6. Extreme exhaustion, and weakness. 7. Cracking around the mouth. 8. Swelling and burning in the mouth and tongue. 9. Restless legs syndrome. To find out detailed information about each one, you can read this article. Other reasons for anemia. Chest pains. Cold hands and feet. Myocardial infarction. Difficulty concentrating. Changes in cognitive status. Cravings for non-food items such as ice, paint, or clay. Ease of breaking the nails and changing their shape, as they become like a spoon. Increased exposure to infections as a result of a weak immune system due to an iron deficiency. Types of anemia. 1. Phe deficiency anemia. What causes low iron? Donate blood. Heavy menstruation. Take some medications. Excessive intake of caffeine. A poor diet with iron sources. Chemotherapy-induced anemia. Some gastrointestinal problems. Anemia during labor and delivery. Iron deficiency anemia in pregnancy. Low red blood cell count during pregnancy. Heavy external bleeding or slow internal bleeding. 2. Anemia resulting from a deficiency of vitamins. This type may result from a deficiency in some types of vitamins in the body, such as vitamin B12 and folate. 3. Hemolytic anemia. It is possible that hemolytic anemia arises as a result of some genetic or acquired diseases, which may cause an imbalance in the body that leads to the production of deformed red blood cells. 4. Sickle cell anemia. Sickle cell anemia is often caused by a hemoglobin abnormality in the blood. This defect is either in the composition or quality of the hemoglobin that is produced, or in the ability of hemoglobin to perform its normal functions. 5. Anemia caused by other illnesses. In some cases, anemia may be the result of some chronic disease, which may cause an imbalance in the production of hormones needed by the body. That's to produce red blood cells in sufficient quantities. Here are some of the diseases that can cause anemia: lupus, cancer, diabetes, kidney disease, hypothyroidism, rheumatoid arthritis. 6. Pernicious anemia. That occurs when the bone marrow fails to produce an adequate number of various blood cells. This includes red blood cells, white blood cells, and platelets. 7. Rare types of anemia. Here is a list of some rare types of anemia, which are less common than the types mentioned above. Sideroblastic anemia, Fanconi anemia, Diamond-Blackfan anemia. When is anemia dangerous? First, the type of anemia and the diseases that cause it. If you are wondering when anemia is dangerous, first, you need to know the type of anemia that occurs. Because some blood types are more dangerous than others. Aplastic anemia, severe thalassemia, myelodysplastic syndrome, Fanconi anemia. To find out detailed information about each one, you can read this article. Complementing the answer to the question, when is anemia dangerous? It is worth mentioning that anemia can also be dangerous if it is associated with these conditions and diseases. 1. Hemolytic anemia. 2. Sickle cell anemia. 3. Anemia of maceratic origin. 4. PNH, paroxysmal nocturnal hemoglobinopathy. Second, complications associated with untiming of treatment. If the patient doesn't get the right anemia treatment at the right time. Here, anemia may be really serious and life-threatening. Here are some serious long-term complications of anemia. Which of these would explain when anemia is dangerous? Constant depression and a bad mood. Increased chances of various infections. Problems in growth, especially in children. Death if the anemia is related to some serious disease. Or if the type of anemia is one of the more serious types. For example, sickle cell anemia. The anemia here may eventually cause the patient's death. Factors that increase the risk of developing anemia: the diet, bowel disturbances, menstruation, pregnancy, chronic cases, slow and chronic blood loss from an ulcer or other source inside your body, genetic factors, the age. To find out detailed information about each one, you can read this article. Prevention of anemia. Many types are preventable. You can avoid iron deficiency anemia and vitamin deficiency anemia by eating foods that contain necessary vitamins, such as iron, folic acid, vitamin B12, and vitamin C. Also, keep eating iron-rich foods, especially for certain groups, such as children, pregnant women, vegetarians, and menstruating girls. To be comforted and to prevent anemia, general blood tests should be performed once every few years. According to the family doctor's advice, avoid items that may inhibit iron absorption if consumed in significant quantities. Coffee, tea, for example. Take iron supplements, only if prescribed by your doctor. Eat foods that are rich in iron. Beef, beans, lentils, and nuts are all high in iron. Breakfast cereals are high in iron, dark green leafy vegetables, and dried fruit. Folate. Folic acid, a synthetic version of this vitamin, is available. Fruits, fruit juices, and dark green leafy vegetables are high in vitamin C. Pistachios, green and red peas. B12 vitamin. Meat and dairy products are high in vitamin B12. And fortified grains, as well as soybean products. Vitamin C. Fruits and citrus drinks are good sources of vitamin C. Tomatoes, peppers, broccoli, cauliflower greens, strawberries, and melons. These are also beneficial to iron absorption. Treating anemia. Treat anemia associated with chronic diseases. There is no particular treatment for this type of anemia. Aplastic anemia treatment. It's treated with intravenous blood administration to raise the number of red blood cells in the body. Treatment of anemia caused by bone marrow disease. It's treated with chemotherapy and bone marrow transplantation. Do not forget to link all requirements for the elimination of anemia in the description box. Treatment of hemolytic anemia. Treatment for this condition includes taking drugs that suppress the immune system, which attacks red blood cells. Treatment for sickle cell anemia. Treatment of this type includes monitoring the levels of oxygen in the body, and taking pain relievers. Iron deficiency anemia treatment. Some simple home recipes to permanently eliminate this problem. Yogurt mixed with coriander. For each cup of yogurt, add a teaspoon of dried and ground coriander. Preferably taken on an empty stomach daily. It can be taken once a day. Yogurt mixed with cumin. For each cup of yogurt, add a teaspoon of dried and ground cumin. Preferably taken on an empty stomach daily. It can be taken once a day. Fig recipe. If you make this recipe, the body will greatly benefit from it in a quick time. The dried figs are soaked in water from night till morning. In the morning we eat 3 figs and drink fig infusion, as well as in the afternoon and evening. This recipe is very good for eliminating anemia. But we must be careful and not overeat. Figures 3 pills are enough at one time. If you want a faster and stronger effect, you can eat fig molasses, date molasses, or treacle. Beet recipe. Beets are very rich in iron, manganese, calcium, and folate, making it one of the best natural remedies for anemia. Not only that, but it also plays a very big role in expelling liver toxins. To learn how to clean liver toxins, the link is in description. American and European scientists have proven that eating 2 cups of raw beetroot juice on an empty stomach is, for 20 consecutive days, the iron levels in the blood improve. With continuity, anemia will be eliminated permanently. Also, 3 days before menstruation, you should drink beetroot juice. And during the first 3 days of menses. This makes your blood never decrease. And the incidence of anemia is almost difficult. As for lactating women and pregnant women, it is preferable to consult a doctor. The banana. Whether it is green or mature, it contains a very large amount of iron. Also contains potassium and vitamin C, which helps to generate red blood cells. But it must be consumed in moderation. 3 times a day, each time eating 1 banana. Black sesame. Black sesame is very good for anemia. If it isn't available, you can eat ordinary sesame, as it is very close to black sesame. Black sesame contains iron and folic acid. Also, it contains calcium and manganese, which makes it one of the best options for the eradication of anemia. Raisin and dates mix. But Muslims must ensure that they aren't forbidden to eat it. But it is possible to eat each one separately, but it will be a difference of hours. After research, it was proven that the fermentation limit shouldn't be soaked. But if it is fresh, there is no problem and it isn't intoxicating. But you must ask before eating this recipe. If you want a medical, cosmetic, or fitness course, just contact us. To buy any anemia supplement, the link is in description. To find out more information, you can read this article.